Hospital systems and Medicare Advantage plans are fighting across the country over how they're going to work together. It is something you should definitely be in the know about. This is something that's a little bit different from our normal videos, but we have an amazing article from Modern Healthcare where we're going to be talking about how Medicare Advantage plans and hospital systems have been at odds over the last year or so, and what that means for you if you are on Medicare Advantage. Now, unlike a lot of our other Medicare news videos, I can't show you the text because it is copyrighted, but I still want you to know about this information, and we're still going to read this together just so you can stay up to date with what is happening. So the article, if you want to check it out, is how a shifting Medicare Advantage market roils negotiations. More providers are opting out of contracts with Medicare Advantage plans as national insurers reconfigure their networks, leaving patients in limbo. So this is obviously very important stuff. We actually locally saw Hackensack Meridian, a big provider and hospital network around here, get into a public fight with Aetna over their Medicare Advantage plans. Luckily, at the last minute, they were able to form a deal where they are going to work together for another 2 years. But these fights are definitely very public and make a lot of people worry. So we're going to be talking about this across the country and what you should know if you are in Medicare Advantage or looking to potentially switch to Medicare Advantage. Medicare Advantage enrollment and profitability surged in recent years as a growing number of seniors sought plans with minimal copays and extra benefits not offered in traditional Medicare. However, Medicare Advantage enrollment growth has slowed, and insurance companies' earnings per member have declined over the past year as insurers grapple with stiffer competition, higher medical costs and utilization, lower reimbursement rates, and stricter regulatory oversights. Medicare Advantage has seen huge growth over the last couple years. It's been a huge driver of profit and revenue for these companies. We're actually going to have a video soon about how it has the highest gross margins currently of any type of health insurance here in America. So it's been a big focus for them, but it seems as though it's not quite as profitable as they would like it to be. So they are making different things to change this. We've outlined where we think a lot of them might be getting rid of ancillary benefits. We're seeing certain plans leave certain markets. So it is something to stay on top of if you are in a Medicare Advantage plan or plan on enrolling in one. Insurers such as Humana have tried to improve their finances by cutting Medicare Advantage plans in certain markets, lowering provider payments, and pruning benefits. That's what we were just talking about. And, I don't want to signal out just Humana here. We're talking about every insurance carrier is doing this in some capacity by and large. Obviously, we're painting with the big brush here. Several large insurers have also ramped up claim denials and prior authorization policies, leading to more contentious contract negotiations with providers. We did a video about this, about how there were, I think, 3.4 million prior authorization denials or something along those lines. I'll link that video down below. But it is a big thing people have been fighting about. Providers have been fighting. Patients haven't been satisfied with those denials and prior authorizations. We did find out the appeal rate is quite high. I think it's close to 80%. But that being said, not a lot of people do appeal. I think only 11% of denials are appealed. So there's definitely a mismatch in people just kind of giving up if they face these denials. This is just the start of insurers' squeeze on Medicare Advantage markets and provider contracts, the effects of which will grow as Medicare Advantage enrollment is expected to account for about 60% of all Medicare membership by 2030, consultants, analysts, and policy experts said. We have touched base on Medicare Advantage is growing. There's a lot of advertising. There's a lot of extra benefits that get people wanting these plans, the dental, the vision, the over-the-counter cards, everything like that. Plus, in general, original Medicare plus a Medicare supplement is just becoming more expensive. And seniors, in a lot of cases, are strapped for cash, and they really can't afford the Medicare supplement depending on their market. So we're definitely very sympathetic, but we're finding this interesting dynamic where a lot of Medicare Advantage plans have been fighting with provider networks. It's not all of them. We'll kind of dive into the specifics here in a few. While people are joining these plans. So, you're joining a plan, hoping for the best, and maybe it's no longer working with your local doctors and hospitals and everything like that. It really just varies depending on where you are. So it's always important to not only check your annual notice of changes with the Medicare Advantage plan, but also look into, are your doctors still contracted? Are the hospital systems and provider networks around you still contracted? Because that can be the biggest switch year over year, even more so compared to like benefits and everything like that. This is the first year that MA plans have really hammered hospitals, and I think it will get uglier, industry consultant Paul Keckley said. Health systems have walked away from in-network agreements or looked to scale up as a buffer and negotiating tool. So just so you guys know, just because a hospital system or doctor leaves the network does not mean you can't see them in a Medicare Advantage plan. In many cases, you can still go. You're just going to have to pay a higher copay, a higher coinsurance, and there might be a little more fight between the out-of-network provider and the insurance company. But, obviously you want to see doctors in network because there's less hassle, but just because a doctor is out of network, especially if you're in a PPO plan, it does not mean you necessarily can't see a doctor. In the second quarter alone, there were 20 public contract disputes between insurers and providers, 75% of which involved Medicare Advantage plans, according to data compiled by FTI Consulting. Since 2022, the share of contract quarrels with Medicare Advantage plans has typically been closer to 50%. So that's a huge spike. It used to be half of all insurance. Now it's about 3/4. Again, as we were reporting on this stuff earlier in the year, we saw a lot of CEOs and CFOs and boards of these big insurance carriers, and this is all public earnings calls. This is nothing that's a secret or anything like that. We've seen a lot of these people signal that they have gotten the market penetration they want. It's about 50% of all people are Medicare Advantage plans. After COVID, people are now going to the doctor more, so they're having to pay out more claims, and they are doing things to make these plans more profitable again, whether that's cutting benefits, whether that's negotiating with hospital and provider networks. So again, this is something we've been reporting on and something for you to look out on. In addition, all right, so here's a couple. Earlier this year, Bloomington, Pennsylvania-based Health Partners said it would drop out of United Healthcare's Medicare Advantage network in 2025. York, Pennsylvania-based WellSpan Health stopped accepting Humana Medicare Advantage plans. Genesis Healthcare System in Kennett Square, Ohio, went out of network with Elevance Health and Humana Medicare Advantage plans. And Raleigh, North Carolina-based WakeMed dropped its Humana Medicare Advantage plan. So these are very regionally specific. We're not trying to signal or call out any specific insurance carrier like United or Humana. We are, for all transparency, contracted with these companies and enjoy working with them. But it is in your best interest to know when these things happen and when we are, looking at these different areas and what Medicare Advantage plans work for the people in that area. So a lot of times these are public facing. If you've worked with these, I know when Hackensack was going through its very public dispute, they were emailing customers and clients directly. So it is something a lot of times you can see and people talk about it online, but stay on top of this just so you know what is the best Medicare Advantage plan for your needs. And if you ever want to work with us, we help stay on top of this stuff with you too. In addition, Sioux Falls, South Dakota-based Sanford Health said last month it's nixing the system's in-network Medicare Advantage agreement with Humana. We've seen this quite a bit with like rural hospitals. I know Sioux Falls is obviously a city, but in smaller markets, a lot of Medicare Advantage plans have been kind of pulling back a little bit. From the provider perspective, they may say, I will get fewer patients if we stay out of network, but maybe I will be better off for it because of the administrative hassle and loss of revenue when claims do get denied, said Paul Ginsberg, health policy professor at the University of Southern California, senior fellow at the USC Schaefer Center for Health Policy and Economics, and a former commissioner at the Medicare Payment Advisory Commission. So that's pretty scary. Providers want to see their patients, but the administrative, hassle of some of these plans, and again, it's not every Medicare Advantage plan, it's just certain, carriers in certain markets. They're saying for us to stay profitable, for us to continue to stay open, we have to cut the cord with some of these. And it's just kind of a scary thought that, people in some capacities are losing their providers because of the insurance that they have. A United Healthcare spokesperson said in a statement it plans to use the remaining months in the Health Partners contract to reach an agreement that maintains in-network access. United Healthcare refuted Health Partners' allegations that the insured delays and denies payment approval. So Again, you got to know there are two sides to each story. I'm sure these contract negotiations are contentious, and I think putting all this in the public eye does put a lot of pressure on both parties. So a lot of times these spats are very public. They can get pretty intense. And at the end, they shake hands and talk about how great it is to be partners with the other person, as if they weren't, talking, bad about each other over the months. Humana and Elevance did not respond to requests for comment. Losing Medicare Advantage contracts isn't an option for some providers. In more than 900 counties, United Healthcare and Humana account for at least 75% of Medicare Advantage enrollment, according to KFF data. So again, it varies greatly depending on where you are. One insurance carrier might be great in one state because they have great relationships with the providers and hospital networks, and it might not be the same in some state. That's why it always pays to work with a broker who's staying on top of these things, specific to your area and your health needs. And that's what we do in about 25 different states. So always reach out to us if you need any help. Shameless plug done. Some health systems have expanded to better weather claim denials and prior authorization requirements, as well as bolster their negotiating power with insurers. So it's one of those things where I'm sure as this stuff has happened, back offices and administrative staffs have gotten better at anticipating these things, and they have been able to better navigate it and maintain profitability and the revenue that they need. For instance, Aspiris Health in March acquired St. Luke's Duluth, a 2-hospital system in northeastern Minnesota. Wausau, Wisconsin, Aspiris grew its hospital market beyond northern and central Wisconsin and Michigan's Upper Peninsula, in part to improve claim documentation, denial reviews, and overall revenue cycle operations, as insurers have denied more claims, CEO Matthew Haywood said. You have a problem with your revenue getting weaker because you're getting paid less, so you want back office scale to be more efficient. So that's really a big issue for these provider networks, is they're spending more on administrative costs to get less revenue. So it's really a fight, again, very specific to your situation, but it is something that these companies, it appears, have been, working together, creating bigger hospital networks to better take care of the administrative burden. Health systems with broad scale and market share will be best positioned to counter claim denials, rate cut proposal, and prior authorization requirements, Moody's Investor Service Analyst wrote in a March report. As profitability of Medicare Advantage products declines amid a Medicare Advantage payment rate cut set to kick in next year, insurers are expected to deny more claims, further limit provider networks, and more aggressively negotiate Medicare Advantage rates with providers, according to the report. So this might just be the tip of the iceberg. This could be the canary in the coal mine, where we've seen about 15 very public contract disputes between these provider networks and these Medicare Advantage plan networks. Again, it's very regional specific. It's very unique to your position. So always keep up to date with this stuff to make sure you are still able to see the doctors that you want to see. At the same time, more health systems will say they don't want to work with certain Medicare Advantage plans that have too many requirements, offer too low rates, and are too strict with clinical judgments, said Michael Bagel, Associate Vice President of Public Policy at the Alliance of Community Health Plans, which represents nonprofit insurance companies. It is coming to a head in 2025, he said. Still, these contract disputes are not indicative of a broad Medicare Advantage plan provider problem. They are about certain insurers and providers who aren't seeing the need to come together, Bagel added. Again, we're letting you know because this is an alarming trend, but there are a lot of people in Medicare Advantage plans who do have good experiences. So just stay on top of the news and everything, and you should, knock on wood, be okay. 4 insurers control 2/3 of the national Medicare Advantage market, forcing providers into a race that dramatically underestimate their operating cost performance, said Jeff Goldsmith, president and founder of the healthcare consultancy Health Futures. It's interesting, too, because sometimes these insurance carriers throw their weight around and say, okay, we have work insurance, we have Affordable Care Act insurance, we have all these different insurance types. If you don't also take our Medicare Advantage plans, you lose all the other stuff too. So in many cases, they can use this as an all or nothing situation. I am an Medicare Advantage subscriber. I do not feel like a customer in my MA plan. I feel like a source of revenue, said Jeff Goldsmith, president and founder of the healthcare consultancy Health Futures. There's a lot of collateral damage if health systems do not think through how they can cushion the effect on what is hopefully a temporary interruption on their coverage of their patients. More disputes are expected to occur over the next year, according to Setseko Staples Miller, managing director at FTI. The contracting statements are adding stress for patients caught in the middle, like Staple Miller's mom, a Medicare Advantage beneficiary who just received a letter saying her local provider may no longer be in network, she said. We saw this a lot, like I said, locally when Hackensack and Aetna were getting into a fight. Again, this was very public. This is stuff we can talk about, but it's just very scary. A lot of people were really in flux because it was actually in the middle of the year this negotiation was happening. So a lot of people were worried they were going to be stuck for about 6 or 7 months in a plan and not be able to switch out, but their doctors would no longer be in network. So, these disputes are very contentious and they can leave a lot of people feeling scared and anxious. And we totally understand that. We don't want to see these giants of healthcare fight each other and leave people to the side. This provokes anxiety for any affected individual, particularly those with complex needs and medication management, Staples Miller said. It can be especially concerning for folks who are living in a part of the country who may not have as many plan or provider choices. A spokesperson for health insurance trade group AHIP said in a statement, Medicare Advantage enrollees have robust protections to ensure access to high quality providers. So that's it for this article. Thanks again to Modern Healthcare for amazing journalism. I would say check them out if you are at all interested in these things. And just know that the next year or two could be a little interesting with Medicare Advantage plans. These contract negotiations most likely aren't going anywhere. And you really want to stay up to date with all of these. So check out our YouTube channel, pay attention to the news, pay attention to things people send you, like your annual notice of changes and everything like that. And if you ever want to work with someone who stays on top of all this for you, you can always reach out to us at NJ Life and Health. So if you'd like to work with us, reach out to us at 848-226-6897 or visit our website at www.njlifeandhealth.com. If you want more Medicare news, more Medicare tutorials, life insurance tutorials, or learning about things in your retirement, check out our YouTube channel. We have a ton of free information for you. So thanks again for your time, and I will see you in the next video.